Hello, everyone. My name is Christine McMahon, and I am an assistant professor at the University of Colorado. Today, I'm going to summarize some of the most exciting highlights in leukemia and MDS from the 2021 ASCO conference. The first study I would like to highlight is abstract number 7002, the phase 2 ZUMA-3 study, which evaluated the CAR T-cell therapy KTE-X19 in adults with relapsed and refractory B-cell ALL. Although the CAR T-cell product tisagenlecleucel is currently approved for pediatric and young adult patients with relapsed and refractory B-cell ALL, there are no current commercially available CAR T-cell products for adults over age 25 with ALL. The ZUMA-3 study enrolled 71 patients with relapsed and refractory B-cell ALL. The CR/CRi rate was an impressive 70.9%, including a true CR rate of 56.4% and a CRi rate of 14.5%. Among the patients who achieved a remission, 97% became MRD negative. Overall, 89% of subjects experienced cytokine release syndrome, but only 24% had grade 3 or higher CRS. 60% of patients experienced neurologic toxicity, including 25% with grade 3 or higher neurotoxicity and one patient with a grade 5 brain herniation. So in summary, ZUMA-3 demonstrated a high rate of response in adult patients with relapsed and refractory B-cell ALL. The safety profile was largely as expected for a CAR T-cell therapy and was generally manageable with standard toxicity mitigation strategies such as tocilizumab and steroids. The other ALL study I would like to highlight is abstract number 7001, a phase 2 study of Ponatinib and blinatumomab combination for Ph-positive B-cell ALL, which was presented by Dr. Short. This study included adults with both newly diagnosed and relapsed refractory Ph-positive B-cell ALL. Ponatinib was given continuously, and blinatumomab was given in 4-week cycles with 2-week breaks between cycles for up to 5 cycles. At the time of this interim analysis, 35 patients had been treated, and 96% overall achieved either a CR or a CR with incomplete count recovery, including 100% of patients who were receiving frontline therapy. Additionally, 79% of subjects achieved a complete molecular response. In summary, this study showed that Ponatinib plus blinatumomab combination is effective in Ph-positive ALL with high rates of complete molecular response. This study is still ongoing, and further data are expected in the future. Now, switching gears, I would like to highlight a few interesting myeloid studies that were presented at ASCO this year. The first is abstract number 7007, a phase 2 study of Aspacytarabine in adults with newly diagnosed AML who were unfit for standard induction chemotherapy. Aspacytarabine is a prodrug of cytarabine. After it is administered to patients, the body gradually metabolizes it to cytarabine over about 8 hours, which results in reduced exposure to high toxic levels of cytarabine. Aspacytarabine is given daily on days 1 through 6 of monthly cycles. The median age of subjects included in this study was 75 years. The CR rate was 39%, which of note was the rate of true CRs with count recovery. There were no CRs with incomplete count recovery. Impressively, among the patients who achieved a CR, the median duration of response was not reached at 12 months. Of note, since this study was initiated, venetoclax and HMA combinations have now become the standard of care first-line therapy for the older and unfit, newly diagnosed AML population. So it remains to be seen where Aspacytarabine might fit in. Additional trials are planned to study this agent for relapsed and refractory AML and MDS, as well as part of combination therapies. The final abstract I would like to highlight today, abstract number 7010, was a phase 2 study of the IDH2 inhibitor Enasidenib in patients with high-risk IDH2 mutated MDS. Enasidenib is a mutant IDH2 inhibitor that is currently approved as a single agent for relapsed and refractory IDH2 mutated AML. IDH2 mutations are also found in MDS at a frequency of about 10%. This study was a phase 2 study with 2 arms, looking at enasidenib in combination with azacitidine for previously untreated high-risk MDS, as well as single-agent enasidenib in patients with MDS who had previously failed a hypomethylating agent. Among the previously untreated MDS patients, the combination of azacitidine and enasidenib led to an 84% overall response rate, including true CRs in 24% of patients and marrow CRs in an additional 44% of patients. Among the patients with prior HMA failure, single-agent enasidenib had an overall response rate of 43%, with a CR rate of 24%. Enasidenib was overall well-tolerated in patients with MDS, with adverse events that were largely expected among patients with MDS-related cytopenias. However, differentiation syndrome was observed in 17% of patients and occurred after a median time on therapy of 1.4 months. The differentiation syndrome was successfully treated with dexamethasone, with or without the addition of hydroxyurea in all subjects. In summary, several exciting leukemia and MDS studies were presented at this year's ASCO conference. I didn't have time to discuss all of them today, but I've shared a few of the highlights. Thanks very much for listening.